Army Medicine is committed to providing the best care where patients want it. To that effort, the committed staff at Winn Army Community Hospital has spent the last 3 years developing a multidisciplinary approach to musculoskeletal lower back pain treatment.
We've worked closely with health benefits and the physical therapy department and all the providers here at Winn Army Community Hospital and outlying clinics to institute an education program to educate providers on a new policy, a new guideline for treating low back pain.
The purpose of the new guidelines is to standardize care and prevent waste of resources utilizing physical therapists from the Department of Rehabilitation to diagnose and treat lower back pain before using radiographic and magnetic resonance imaging.
The research really indicates that early imaging for patients who just have back pain without radiating symptoms is really not effective in treatment and actually drives up not only the cost but also does involve some risk.
The results the patients got after these tests were actually worse than the improvement they saw when they were treated on the basis of their symptoms without any imaging. So the patients did better with a non-imaging approach than they did when they got imaging with the initial onset of pain.
In early 2013, a multidisciplinary team began working on the implementation of robust process improvements to treatment plans involving lower back pain.
Our intent was to educate providers, to educate patients, to follow the clinical practice guideline, but to ultimately get better outcomes for those patients that are complaining of low back pain.
My part is gathering the data from the systems that are available and sharing that data. Also communicating with all the clinic leadership on when we had an improvement so that they knew we're doing the right things to improve our patients' care.
It really is a team effort to try to institute a better care guideline for our soldiers. We couldn't do it ourselves.
In mid-2014, a physical therapist was embedded at Hawks Troop Medical Clinic, which provides direct access for the patient to the PT program. The program started as a pilot to address acute musculoskeletal injury, and now is featured at the Richmond Hill Medical Home and Tuttle Army Health Clinic.
And primarily Hawks has been our centerpiece. It's the most mature program that we have. The patient has direct access to the physical therapist. That too feeds into evidence-based medicine, which indicates that early access to rehab tends to produce better outcomes at lower cost. The faster that you can treat the back pain complaint, usually the better the outcome is going to be.
So the soldiers had, again, early access to physical therapy. That treatment got them back to the front lines much quicker than having to wait for radiology and then starting PT. I think that really impacted our readiness.
The expectation is changed even today. When a patient comes in, we get very few early requests for an MRI. I think most have been educated at this point that, okay, that's an imaging procedure that's only reserved for significant cases that have not resolved.
As a result of the multidisciplinary process, the HEDIS measurement for lower back pain increased from 10 to the 90 percentile in a 28-month time frame, ensuring Winn's continued commitment to delivering the highest quality health care.
And we're setting the benchmark for standardization across the enterprise.
For Winn Army Community Hospital Public Affairs, I'm Zach Rehnstrom.